Folks, thanks for coming on the line with us today. My name's John Dubas. I'm the Vice President of Agent Success for Premier Marketing. Today we'll be spending the next 45 minutes to an hour or so discussing some basics about an opportunity that agents have on a year-round basis to offer Medicare Advantage special needs programs that are designed for the dual beneficiary, lovingly referred to in certain circumstances as a DSNP, but we'll be spending some time going through generalities on these programs and get into some specifics for you, things to watch for and things to use to your benefit. A bit of a background about our organization up front. We are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country offering insurance contracts as an insurance wholesaler to independent insurance agents in all 50 states. And those contracts are available at the highest possible commission levels with recruiting contracts available for those who qualify. As I mentioned, our organization at Premier was founded in 1968, so that makes this our 50th anniversary. We're proud of that accomplishment, and it's an illustration of the opportunities that we enjoy in our country. In addition to that longevity, we are also one of the largest organizations of our type and are the largest producer for Medicare Advantage programs for United Healthcare, Anthem, and Meridian Care, and one of the largest producers for multiple organizations in the Medicare Advantage world for other companies as well. This gives you a bit of a idea as to the breadth of our organization and our partners within the Integrity Marketing Platform. And it is part of a offering that is made to agents on a full portfolio of products with multiple types of programs available for folks who are on Medicare, including Medicare Advantage, Medicare Supplement, and PDP programs. We also offer a full platform of life insurance and annuities, including final expense products, pre-need, long and short-term care, disability income programs, and ancillary benefits for folks of multiple ages. This gives you an idea of the Medicare Advantage portfolio that we offer, and you'll note in this particular slide a lot of asterisks, and I did that on purpose because that gives you an idea of the number of organizations that are offering dual special needs plans as part of their product portfolio. We've seen a proliferation of these programs in the recent past. We see a lot of organizations investing a ton of money in DSNP programs, and I think you're going to see that grow even in the future, with many of the states deciding to basically go into a managed care program for the Medicaid benefits within their state. You're seeing a lot of these companies realize the value of these programs and look to invest huge dollars into the opportunities that are presented by this demographic. We do also offer a full portfolio of PDP programs and Medicare Supplement programs as well. What we're going to do today is give you a little bit of information about the Medicare market on an overview basis, some information on SNPs in general and DSNPs in particular, speaking to the qualifications that folks need for different programs within this area, and also some complicating factors that we have with the government looking to become more efficient and deliver healthcare on a much more efficient basis. And then we'll give you also some additional market information to give you an idea as to whether or not this can be a viable opportunity for you within your own portfolio of products. Anytime you get on a program like of a nature like what we're talking about, when you're dealing with the senior population, or marketing organizations and carriers love to tell you about the aging of the baby boomers and how this market is dynamic and growing and in need of folks that service this particular portion of the insurance world. And that's very true. But when we look at it overall, we have to keep in mind that it's not just the aging of prospects and the aging of our population into the Medicare market. We also need to keep in mind that a good percentage of people on Medicare are under the age of 65, and many of those folks fall into today's topic of being a dual special needs prospect. So we're going to look at that as well. Income, well, it's the old expression, people don't plan to fail, they fail to plan. In many circumstances, part of the generation we deal with had the idea that Social Security was going to be there to take care of them. And we can see that the majority of people on Medicare need our help with additional programs to assist them in handling the expenses they have in the care that they seek and the prescriptions that are part of the solution to their healthcare problems. The Medicare population also has a number of different demographics that come into play and affect how we deal with them as well. And this gives us an idea when we look into the different types of special needs programs that we'll touch on very briefly in just a moment. The government does put out a ton of information on special needs plans, and most folks don't know about it. Well, going to CMS's website and Medicare.gov, you can get additional information, but guides are actually available for Medicare special needs programs, and that is going to be part of the follow-up to today's presentation, because today's presentation is being recorded, and everyone who has expressed interest in it will receive additional follow-up with collateral material. Why would folks want to work the low-income market? Well, there's been a change in 2019 over 2018, but folks that are affected by income and assets, we all are, but those that are particularly affected by having low income and assets, these are folks that are generally eligible for a quarterly special election that is based on that income and assets. I say quarterly because in the past it has been month to month. It was a continuous special election period. That is a change in 2019 over 2018, and is something we need to be very mindful of. Special needs plans themselves were created by an act of Congress back in 2003 as a type of Medicare managed care programs to focus on certain subsets of the Medicare population. And these are programs that will limit their membership to people with specific, easy for me to say, diseases or characteristics, and they then tailor their benefits to address that group. There are actually three types of special needs plans. There's the chronic special needs plan, the CSNP, which is available to people with certain severe or disabling chronic conditions. There's the institutional SNP, which is directed for folks that live in an institution like a nursing home or may require special nursing care at home. And then there is the dual special needs plan that is directed for people who have Medicare and Medicaid. Keep in mind, in order to be eligible for a Medicare Advantage program, you got to have Medicare Parts A and B, you got to live in the area where the program is available, and you can't have end-stage renal disease. Special needs programs add an additional qualifying factor depending upon the special needs plan, where the chronic program, you got to have that named disabling or severe chronic condition. Institutional SNPs, you got to live in a facility that's eligible for those types of programs. But with the dual special needs program, that eligibility is based on income and assets. And in most cases, it requires an individual to have subsidy of some of their Medicare expenses through a different entitlement program. When you look at the number of SNPs that are available, I referenced earlier when we were looking at the portfolio of the proliferation of companies that are beginning to offer dual special needs programs. There are a number of organizations that stand out from the crowd when you deal with this particular population, and they're generally the same ones that many of us think of as some of the leaders in the general Medicare Advantage world as well. Head and shoulders above the rest when it comes to pure numbers of members, United Healthcare has been active in this portion of the Medicare population needs and has been doing it very well, and they are the strong leader when it comes to numbers of dual eligibles. However, there are, as I mentioned earlier, a ton of other companies that are beginning to offer this program, and it is still an area within the Medicare world that is vastly underserved. So unlike certain states where the Medicare managed care population is getting a little bit saturated, this area, there is a need for additional assistance through these programs. And one of the reasons why is because most people who are on Medicare spend at least a third of their income on health care. You couple that with some of the lower income challenges that they face, and you realize that the discretionary income after making their payments on their Medicare costs, medical costs, that there's not a lot left. So some of the things that we can do to help them makes a huge difference. A lot of times when you speak with the general population, they will have a sense of confusion when it comes to Medicare versus Medicaid. A simplified definition, of course, is Medicare is based on folks that are over a certain age, 65, or have certain chronic or disabling, I should say, conditions and qualify for Medicare in that circumstance. So it's based on age and health in a generalization. Medicaid, well, health may come as to a one of the reasons why they're in the situation they are. Age isn't a determinant necessarily, but this is based on income and assets. The programs are administered by each state, and they set their own guidelines according to eligibility and services. There are certain groups that would not be a prospect for us in the Medicare market because they're not on Medicare. This may be folks who are much younger or pregnant, disabled, blind, and qualify on that basis and still fit the parameters that are given to them by the individual states based on their income and their assets. Keep in mind, too, that these income and assets levels will vary according to the different level of assistance that is available to the individual. And we look at the folks that are in nursing homes and our Medi-Medi, you got a different animal in that circumstance. What we're talking about are folks that are active or still in the community-based individuals. The program can be complicated by certain states now instituting what is called an MMP program. And this is the federal government and the states kicking through programs that are designed to serve members of the population that are both Medicare and Medicaid into a singular plan. It's not a program that agents market, but it can affect you in different markets depending upon who you contract with and how that program is delivered. These are non-commissionable type of programs since agents aren't involved, but these are also available only in certain states, and within certain states, only certain counties within those states. It can make a huge difference as to how you market programs, and you got to be mindful of whether or not this type of program is available in your chosen market. This will give you an indication of those demonstration states, how long it's been in place. Many of these demonstration programs have been extended. Some of them have been discontinued. So when you look at a consideration of the dual market as part of the portfolio product that you offer, we need to do some research and make certain that it works for you and you're not a social worker, you're an insurance agent offering additional assistance programs. In Texas, this demonstration program is referred to as STAR Plus. It has come into the state in different phases, and we saw it roll out much earlier in certain more urban areas, and is now a consideration in every county in the state of Texas. What happens in this circumstance is you have the large insurance companies that will bid on the administration of the Medicaid benefits in different markets. And in Texas and in many of the other states, they will have multiple carriers administering those benefits, the Medicaid benefits. The folks can opt out of the program that are eligible for it, should they choose to do so, but it's also a circumstance that we can't really counsel them to do so. when it may not be in their best interest, of course. So it gives you an idea of the scope of these programs and the fact that even if a person is in a managed care program for Medicaid, in many circumstances, enrolling them in a DSNP program for Medicare benefits can be of a great advantage to them regardless. This is the demonstration product in the state of Texas. Remember where I mentioned that it's only in certain states and in certain counties? Well, there are 250 plus counties in Texas. The demonstration product is only in 6 of those counties. Noteworthy enough, though, the big population centers. What we have more of a concern of when we deal with this as a niche market is what qualifies that individual for a DSNP. Well, as I mentioned earlier, you still have the same factors of qualification as you do with a regular MA program, where they've got to be on Medicare, A and B, got to live in the service area where the product is available, cannot have end-stage renal disease. In most circumstances, it also requires an individual to have a full package of benefits through the assistance programs called Medicare Savings Programs. And these are programs that help the individual with cost on the Medicare side when it deals with their health expenses. We're not talking about the low-income subsidy extra help program that people can qualify for their prescription programs. This deals with assistance for the Part B premium and the deductibles and co-insurance that an individual is subjected to without this type of assistance. It's important to note that the majority of the dual special needs programs require a full dual beneficiary, which means they have to have at least QMB status or greater. There are some limited exceptions to that where certain carriers in certain markets will allow a person participation in these programs even if they have SLIMB or QI1 coverage, and we'll go into that in just a little bit as well. What were all those acronyms? Well, they're being explained in the later slide as well. Now, later slide, it's now. 3 of the programs that make a difference for us as insurance agents, and these are things that we need to be aware of and very comfortable with when you deal in this market, is the different levels of assistance that is available and what a person gets when they qualify for these different levels. The qualified Medicare beneficiary, QMB recipient, sometimes called the QMB, this is a program where folks are at 100% of federal poverty level or below, and this program then pays their Part A premium if applicable, Part B premium, and also pays their Part A and B deductibles, co-payments, and co-insurance. This means a person is out of pocket very little for medical expenses based on their circumstance here. You also have another level of assistance called a specified low-income beneficiary, a SLIMB, SLMB individual. This is a person who is at 115% of federal poverty level. I'll show you in just a second, but it only pays the Part B premium, much as what happens with a qualified individual, a QI1. This is where it pays just the Part B premium, and the person is still subjected to their Part A and B deductibles, co-payments, and co-insurance. How do these programs work? Well, it's a coordination of assistance between federal agencies and the state governments. CMS oversees the program. They provide matching funds for QMB and SLIMB, and they provide a block grant for QI1. The state Medicare agencies administer these programs, and so that qualifications and administration can vary from state to state. They determine the eligibility, and they then pay the Medicare Part B premium on behalf of those who qualify, and the co-payments, co-insurance, and deductibles to health providers for the QMB individuals. That makes a big difference when it comes to what person qualifies for what type of assistance, and because of that, what type of additional policies that we offer that are compensated on a commission basis that can help the situation. This is kind of a cheat sheet for you with the different levels of assistance for one program or another. So this is a combination of numbers for folks up to 150% of the federal poverty level based on 2018 numbers. 2019 numbers generally come out in March or April of the year in question. So these numbers will carry over until the new numbers are revealed. And what this does is it gives you a piece to reference as part of your overall presentation package. We've just come out of the annual election period where many folks have been very busy marketing general Medicare Advantage programs, but many of those folks may have not closed the door behind them as securely as possible by not speaking to these programs. Because you can't always judge a book by a cover when you're in a house when it comes to income and assets. This then gives you an idea of the first three levels, how it can help payments on the Medicare expenses. The LIS deals with the drug programs. So you've got numbers that vary from an individual to a couple, and the asset limits vary that same way as well. As I need to note here as well, the assets test is one of the variables that doesn't apply in every state. So you will see people who move from one state to another may qualify in one state but not the other because of inclusion of the assets test. Some additional information that's available to you for reference here, the fact sheets and eligibility charts are available from the National Council on Aging Center for Benefits. It's a live link that will take you there. CMS memos that help explain this for you in greater detail as well. And then the benefits checkup program that is made available through this organization, and in many circumstances is subsidized by some of our insurance partners. Anthem and Aetna come to mind right away as insurance carriers that utilize this for a tool for you as an agent to see if there is an additional assistance that you can find for your prospects and clients. Because keep in mind, even though we came out of a very hectic annual election period, people sell all year long. And the joy of this particular program is the fact that it's a quarterly SEP. So these people could actually change their coverage 4 times a year should they choose to do so and it be in their best interest. How do you work the program? Well, first things first, you got to be prepared. When you get into certain markets, and we're going to demonstrate that here in just a second, we can see where the programs look very similar. So how do we know which might be appropriate for the individual we're speaking with, or even for us to have as part of our portfolio? Because you do have additional certification to go through to offer these programs, and as we all know, time is money, so we need to know the differences. So in the different markets, it behooves you to get the information about the plan itself and the network. One of the things that you'll see is network makes a huge consideration in this niche as well, and it may surprise you. It may not be as focused on a particular doctor or hospital. It may be one of the ancillary services that are delivered by home health care agencies or durable and medical equipment companies that can make a difference, believe it or not, and it will happen. It's also important to note the assistance programs that are available in a particular area, because they can vary from area to area and from state to state. Are you dealing in a market that is a demonstration plan market? Are you in a state that has managed care for Medicaid as well? And are you familiar with the different levels of assistance under Medicare savings programs and low-income subsidy? Because you'll find a difference in the mindset with some of the individuals that are of varying levels of income. LIS allows you also a quarterly special election period, but because LIS gives you that opportunity to change plans, it doesn't necessarily qualify someone for a DSNP program, so you would use a regular Medicare Advantage program. One of the things that you'll find in this area too is the appointment time is generally longer, because you'll find yourself in need of repeating certain information, making certain that all the key individuals that are part of the decision-making process are involved, and that you go through and do a very thorough fact-finding to make certain that you are discussing all of the providers of care that an individual has in this particular market. Generally, when you work the Medicare Advantage market, you'll run across an individual that works and needs durable medical equipment or may have home health care, but you'll find that those individuals come across to you much more frequently in this market, and it is important for you to identify those companies and lay the groundwork for the fact that, well, that can be actually covered by Medicaid and not Medicare, so it wouldn't affect the delivery of that service or the payment of that service with their current provider of those services. The lock-in can work both ways, for and against you, because as I mentioned, it's a quarterly special election period, so that person can change quarter to quarter. And we know what happens to our particular commission structure. If someone opts out into a different program with someone else, you could lose your entire commission depending upon how long they've been in the program. As I mentioned a little bit earlier, it's critical to work with the family and all other decision makers that are involved with the process. There's been a number of times in my personal business conduct where I've run across folks and I've discussed the program with the beneficiary, and I missed a son or a daughter and involving them in the beneficiary decision. And so then that son or daughter can come in the house and say, "Mom, Dad, what did you do? You don't need anything additional," because they don't understand the program, and they can work against you when it comes to keeping that person on the health plan that you delivered for them. It's also important to note that any overview like what we're going through here today doesn't give you all the information you need to sell a program correctly. It's important to work with the carriers with whom you contract, that you attend their trainings, that you work with their local management to make certain that you know the intricacies of the network that is involved, what makes their plan different than other plans, or in many circumstances, how you explain the differences between a DSNP program and someone who has just Medicare and Medicaid. It's important you have that knowledge as part of your bag that you can dig into to help explain programs, and that you use the training that you've been delivered and the support material that's available to you from the carriers and the government itself. Some of the differences that you'll see in the programs, particularly coming into 2019, we've seen a loosening of what can actually be delivered as part of a benefit package. In 2019 over 2018, we see much more opportunity for perhaps in-house meals or different things that can extend different benefits based on how a carrier delivers these extra benefits. And these are some of the things that will take a person from, "Nah, I'm not interested," to, "Wow, I really need that program." Some carriers will emphasize certain key benefits, such as vision benefits or hearing aids or dental. That's a big differentiator between a lot of the programs. And it's important to note what are some of the key indicators that your prospect and client are revealing to you to make certain that you know this is a suitable opportunity for you. And this is also then an opportunity for you to look at and compare some of the different programs that are available in your area to make certain you have what you need as part of your product portfolio to adequately service this particular portion of the market. I alluded to the second point a bit earlier in the fact that we do need to look at the providers that are part of the program, just as we do on any managed care program, but to remember to go through all types of providers. Many times a person who has Medicare Advantage coverage doesn't really perceive some of the same need or urgency for a home health care provider or for that durable medical equipment company. It's critical in this key area to make certain that you explain those benefits how they're coordinated, who funds what under Medicare and Medicaid, and how that can make a huge difference to them. Keep in mind, many times when we deal with a prospect or client, you may have talked to them once, 2, 3 times to get the appointment. You go out and visit them. Maybe it requires a second appointment to come back and close. But at the busiest that you have with a lot of these prospects and clients, you see them 4 or 5 times. Many of the deliveries or deliverers of the care that I just referenced, the home health care organizations or the durable medical equipment companies, they may have been associated with that prospect and client for a number of years, have a special relationship, and if they're not part of that network that you deliver with your dual special needs plans, you won't have that plan in place very long. So it's important to make certain that you explain how plans are available, how the benefits are available, and how the providers are available. Because many of these, particularly the home health agencies, will come back and say, hey, you signed up with that plan, you're not going to get our benefits anymore. Well, they may still qualify for those benefits, just with a different company. So we have to cover ourselves to make certain that our prospects understand that. You also have a number of carriers that are very good at delivering the support that you need when it comes to explaining those provider relationships. And there are a number of them as well that really give you additional strong support when it comes to material needed to explain the different benefits, the different nuances that are available for their program. And that's utterly important for you to have and for you to understand so you can relay that information to your prospects and clients as well. It's also important to note that certain carriers are really, really, really good at delivering marketing support as well. That may be flyers that are customizable for you in reaching out to this population. It may be assistance in marketing events. It may be pull-up banners. It may be a whole bunch of different things that the carrier has available. We're seeing more and more companies offer agent toolkits that allow you to go in and alter certain documents with your personal information that remain compliant for you to market efficiently and effectively in a particular market. When you look at different markets and you look at the different carriers, this can be a huge differentiator for you as to who you work with and why. And as we spent a bit of time earlier talking about the managed care programs that are available on the Medicaid side, keep in mind the majority of the folks that are contracted to deliver the managed care program for Medicaid, which we as agents don't have anything to do with when it comes to sale or explanation or delivery, these folks do have an opportunity for you to market more efficiently as well. Many of the companies that have a Medicaid contract also offer a Medicare program, and it behooves them to have as much business in the household as possible, much as it behooves you to do the same thing. So knowing who has those types of contracts may be a determining factor as to who you contract with and who you market to as well. Many times, those programs give you additional access into different providers and other partners within that same marketing effort to make you more efficient and more effective in delivering these programs. How do you find them? Well, much as what we do in many of the other circumstances is utilize Medicare.gov. Going into a particular area and pulling the plans that are available to you will give you an idea of who is there, because if we tried to list this out for every county and every state in the country, you'd be much more tired of my voice than you will be by the end of the presentation anyway. So we can go in there and determine what plans are available where, and you can do so by selecting the special needs programs and pulling up those plans in your particular market. Because a general analysis, unless you note these, they won't pull. and it'll then give you the programs that are available in a particular market, which is you use that analysis for other programs through the open enrollment period as well. Let's see here, just a second. Let's demonstrate that live here. If we go into Medicare.gov, we find health and drug plans. We look at a zip code that we're marketing in, just a demonstration piece here. You'll see that certain zip codes may overlap different counties, and that's important because some plans may not be available in a county right next to where you're marketing. You can plead the ignorance piece on this. You'll want to make certain that you put in at least Medicare savings programs, an additional qualifier for this analysis. And because we're looking just to see plan availability and not a true comparison of cost, it gives us the opportunity to pass up having to add all the drugs into the analysis as well. We're looking just for product footprint in this circumstance, not necessarily in comparison to the plans themselves. So we'll see in this zip code in North Texas, there are a number of programs available, but here's that special needs column that we need to include the dual beneficiaries, and if you're active or looking to target the folks who have certain chronic disabilities, you'll want to pull that up as well. We don't generally click on the long-term care facilities because in most circumstances, that is not a product that's offered through the broker channel and is non-commissionable. So while we want to be cognizant of all coverages that are available, we also want to make certain that we stay focused on the areas in which we can deliver assistance as well. So let's take a peek, select the programs that are MAPD plans, and do an analysis. So Medicare tells us, Medicare.gov tells us that in 2019, in this particular zip code, there were 46 plans available. Remember, in the previous piece where we pulled it off, it showed that we had about 14 plans less than that. Let's look at them all. And this is going to tell us a number of different things by just how they label the product. So this first program that is available in Lewisville, Texas, is a dual special needs program that is focusing upon the STAR plus Medicare, Medicaid population. So this will tell us in our circumstance here that that's a program you need to be aware of, but it's also a program that we don't sell and get commissions for. You'll see there that this gives you an indication that Molina is offering this Medicare Medicaid program. This is a commissionable program because it doesn't have that designation of that MMP, that demonstration of the dual plan offered by the state and federal government through third-party administrators, not agents. Here's one labeled HMO SNP. That is a commissionable product available through Amerigroup. You have here then Cigna HealthSpring. And in our market here, in many parts of Texas, Cigna HealthSpring is that exception that I mentioned to you a bit earlier, where a person who just has their Part B subsidized can still qualify for basically the same benefits on a dual SNP program. That is an exception in this market that you don't see everywhere and can make a big difference for certain folks who don't have enough money but have too much money to really qualify for full assistance. So it goes through then and it tells you anytime you see that SNP designation that this is a program aimed at that particular market. You'll note here, United Healthcare actually has 2 dual SNP programs in the same market. They offer a dual special needs program in every county in the state. They're administered separately, however, something to be aware of. So it goes through and it gives you an idea of the different options that are available to you. And you can see as we scroll through this, it takes us to come down clear to here before we go out of the HMO SNP designations that are available to us. So this is an area that has a proliferation of plans available, a ton of programs that are available to you to address the dual beneficiary market. And it gives you then the idea of what it takes to identify what you have available, which is what we tried to demonstrate here. In 2018 in the state of Texas, you'll notice in different key markets across the state, there are different offerings available as well. So the plans, as other Medicare Advantage programs do, can vary in benefit from market to market, in most cases do. So you'll see a dual special needs plan in Dallas-Fort Worth be different than a dual special needs plan in, say, El Paso or the Rio Grande Valley when it comes to benefits. So we have to be mindful of the fact that that qualifying factor of do they live in an area where a plan is available can change benefits from market to market. So something that's very important for us to go through and consider. It gives you then an opportunity to make certain that we then identify carriers with whom we would like to associate, with whom we'd like to contract and certify. And there are many of you that may have certified for regular MA during the open enrollment, delayed the certification for the DSNP program, and it would behoove you to go in and do that now, obviously. So something to consider there too. It also then gives you an idea of, I may need this contract in this market to be effective. And once we have determined those factors, it's then very important for us to establish a relationship with local management of those carriers in that particular market, because they may have events scheduled that they need help with. So you can access marketing through that organization. They, in many circumstances, also may be able to tell you the differences between the network that's offered for a dual SNP plan as opposed to a regular MA plan. They may vary in particular markets. And it's also an idea of where, if they get different leads coming in, that you were on that list of the grateful few that receive that sort of assistance as well. So some of the things that you get from us, in addition to what you have with the dual special needs programs, is assistance with discounted E&O, so you can market to these individuals comfortably and compliantly. We also make available to you discounted means of continuing your education to maintain your license. We have an electronic means of contracting where you can go in and set up an agent profile and then contract with multiple carriers without having to go through and complete differing contracts manually. This will do it for you electronically. We do also have different training programs that can be helpful for you for different circumstances. If you're looking to market into the community, because that's something you'll want to do in the dual SNP market, is keep in mind that you may be able to access this market more efficiently by working with providers that are delivering the care for these people. We have programs that help give you hints and tips and train you to do that. It may behoove you to go to where they live or worship, and that is another means of delivering a message, either through camps at different locations of that ilk or through seminar selling. And so we have those different pieces that are available to you as well. And it gives you an opportunity to add just another arrow in your quiver of marketing tidbits to help get you in front of individuals. Because generally you won't run into an entire crowd that has the exact same eligibility factors, but you may have folks that are of a common interest in things, and having these additional trainings available to you can be very helpful. As this presentation is being recorded, so has many others in the past, so you have access to a library of webinar recordings that you can access 24/7 should you choose to do so. We do also offer electronic support with electronic enrollment programs, different quote engines for different programs as well. This is really important for us as we move forward. When I was the regional director for Evercare, there's a name out of the past, a long time ago, one of the things that we found with applications for Medicare Advantage programs is the vast majority of them were being pended simply because our penmanship really needs help sometimes. So delivering an enrollment on an electronic process can be of great help for you in making certain the business comes through. We do also offer an exclusive program to put your social media on autopilot. Coverage Made Easy is a program that for a small monthly fee can keep your name and face on different social media programs. And we offer also a full menu of lead programs to help you get in front of people. A contact list that allows you to cold call. Obviously, you can't do that for dual SNPs, but you can do that for the vast majority of Medicare supplement programs or ancillary programs, dental programs, hospital indemnity programs, things of that nature. As I mentioned earlier, those additional assistance on community-based marketing programs, including retail, faith-based and provider marketing programs. We also like to make certain that as you deal with a particular insurance carrier, that you have access to all the actual living support that that carrier makes available. And so you have agent success managers in different markets that we need to make certain that you're tied into so they can help you not just as a source of information, but also possibly as a source of marketing support as well. Internet leads, we generally caution the use of internet leads when it comes to Medicare Advantage programs because we want to make certain that those leads were generated compliantly, but it's there for you. And we do offer also direct mail support. With production, we actually co-op that cost, so it makes that mailing much less expensive for you. What we look to do is visit with you to see, do you feel that this type of program is a viable component of your overall marketing program? Is it something that you have additional questions of that are particular to your market that we need to help you evaluate what your possibilities are? And then once you have decided to move forward, as we want your business, we want to then make certain that we have all your qualifying factors in place. Do you have the proper contracts? Are you certified? Have we discussed a marketing program that lasts more than 2 weeks to make certain that we stay in this and do it consistently, working through all of the support that we have available? This is the contact information for our organization. You can dial 1-800-365-8208 and reach any marketer with Premier Marketing in any of our locations. The folks listed here are the folks that are in our Dallas office. And if you're in this market, we invite you to come by and visit with us. We'll give you a tour of our offices. We're right off of Beltline and 635 headed toward DFW Airport. All that said is we invite you to thoroughly investigate dual special needs programs in general as part of your marketing plan. We then invite you to look at the analysis of different carriers that are available in your market to make certain that they will work for you as well, and then agree to work forward with us to make certain that we're driving additional revenue to your agency and are a critical partner in your overall success. That said, I want to thank you for coming on the line with us today. I'm going to make certain that anyone who has asked a question in the chat box receives that answer as part of the follow-up to today's presentation, and we'll go from there. We look forward to visiting with you in the near future, and as my voice fades out here, we wish you good selling. Thanks so much. We'll talk to you soon.